Warning signs of pancreatic cancer you should never ignore. Pancreatic cancer is one of the most dangerous and deadliest forms of cancer. It's often called the silent killer because it hides in your body without showing clear signs until it's too late. The pancreas is a small organ, but when cancer takes hold there, it spreads fast and viciously. Most people don't even know they have it until the cancer has reached an advanced stage, making it incredibly difficult to treat. In fact, the survival rates for pancreatic cancer are shockingly low because it's often diagnosed too late. The truth is, if you don't catch it early, your chances of survival drop drastically. This is why you need to know the warning signs. Missing them could mean the difference between life and death. In this video, we're going to talk about those critical warning signs that you must never ignore. We'll also cover how pancreatic cancer is diagnosed, what treatment options are available, and the risk factors that could put you or your loved ones in danger. Before we dive into all of that, we're getting so close to reaching our milestone of 500 subscribers, and we would love your support. If you find this video helpful, go ahead and hit that subscribe button. All right, let's get started. 1. Jaundice. Yellowing of the skin and eyes. Jaundice is one of the most common and early signs of pancreatic cancer. When something blocks the bile duct, such as a tumor, bile starts to build up in your bloodstream instead of flowing into the intestines. This buildup causes the yellowing of your skin and the whites of your eyes. But jaundice isn't just about looking yellow. It often comes with itchy skin, dark urine, and pale stools. Imagine having itchy skin that won't go away, and your eyes look yellow. This is a clear sign that something isn't right. If you ever notice these changes, it's crucial to see a doctor right away. 2. Abdominal and back pain. Pain in the upper stomach and back. Pancreatic cancer often causes pain in your upper abdomen, but this pain can also move to your back, making it feel like it's radiating through your body. This isn't the type of pain that comes and goes. It's constant and gets worse over time. At first, people might confuse it with typical stomach aches or even back issues, but this pain is different. It sticks around and intensifies. Some people describe it as a dull ache, while others feel a sharp, stabbing sensation. If you're having this type of pain regularly, especially if it feels like it's reaching into your back, you need to pay attention. 3. Unexplained weight loss. Unexplained weight loss is another big sign to watch for. This means you're losing weight without trying. No special diets, no extra exercise, nothing. It's because the pancreas plays a major role in digestion. And when it's not working properly due to cancer, your body doesn't absorb nutrients the way it should. Over time, this leads to weight loss. So if you find yourself dropping pounds and can't figure out why, it's a warning sign that your body might not be processing food correctly, which could be linked to your pancreas. Loss of appetite. Feeling full after eating just a little. Imagine sitting down for your favorite meal, but after just a few bites, you feel stuffed. That's what happens to many people with pancreatic cancer. You lose your appetite and can't eat much, even though you know you're not full. This can be linked to the tumor pressing on your stomach, making it harder for your body to process food. Losing your desire to eat, combined with unexplained weight loss, should definitely make you think twice and get checked. 5. Nausea and vomiting. With a growing tumor in the pancreas, other organs around it can start to feel the pressure. This can lead to nausea and vomiting, especially after eating. It's as if your body is rejecting food because the digestive system isn't working as smoothly as it should. Sometimes people with pancreatic cancer can't keep food down at all. If you're feeling sick to your stomach regularly or vomiting often after meals, don't brush it off as a simple stomach bug. It could be something much more serious. 6. Dark urine. Most people don't pay attention to their urine, but if you notice your urine turning dark, like the color of tea or cola, this could be a major red flag. When there's a buildup of bilirubin in your body, often due to a blocked bile duct, your urine can change color. This isn't a subtle change either. It's pretty noticeable. So if you see this and can't explain why your urine is darker than usual, it's time to see a doctor. 7. Pale or greasy stools. Changes in your stool are another warning sign. Normally, bile helps break down fat in your digestive system. But if bile isn't getting to where it needs to go, your stools can become pale, greasy, or even float in the toilet. This is because your body isn't digesting fat properly. It's not the most glamorous thing to talk about, but these changes in your bowel movements are important to notice. 8. Sudden onset of diabetes. Your pancreas is responsible for controlling your blood sugar, so when a tumor disrupts its function, it can lead to sudden diabetes. If you've never had issues with blood sugar before, but suddenly develop diabetes out of nowhere, this could be a sign that something is wrong with your pancreas. Even people with no family history of diabetes can develop it quickly if pancreatic cancer is present. 9. Extreme fatigue. Feeling completely exhausted all the time, even when you've had plenty of rest, could be a sign of pancreatic cancer. This type of fatigue doesn't go away after a good night's sleep. It lingers and can make it hard to get through the day. Cancer takes a lot of energy from your body, so if you're feeling worn out for no clear reason, take it seriously. Now, let's talk about what could put you at risk for pancreatic cancer. While anyone can develop it, there are certain risk factors that make it more likely. Smoking is one of the biggest risk factors. In fact, people who smoke are 2 to 3 times more likely to develop pancreatic cancer than non-smokers. The chemicals in cigarettes can cause damage to the pancreas over time, increasing the risk. Family history also plays a big role. If someone in your family had pancreatic cancer, you're more likely to develop it too. That's because certain genetic mutations can be passed down, raising your risk. Another factor is chronic pancreatitis, which is long-term inflammation of the pancreas. This condition makes the pancreas more vulnerable to cancer, especially if it's been inflamed for many years. Obesity is another important factor. People who are overweight or obese are at higher risk because excess fat can lead to changes in the body that promote cancer development. Age is a major factor. Most people diagnosed with pancreatic cancer are over 60, although it can develop earlier in some cases. So how is pancreatic cancer diagnosed? Doctors use several different methods to figure out if someone has this type of cancer. A CT scan or MRI is often one of the first steps. These scans allow doctors to get a detailed look at your pancreas and see if there are any abnormalities, like a tumor. Another important tool is blood tests. These tests look for specific markers in your blood that could indicate cancer. For example, a substance called CA19-9 is often elevated in people with pancreatic cancer, although it's not a perfect test. Elevated levels can point to the presence of cancer, but it's not always 100% reliable since other conditions can also cause these levels to rise. So while it's helpful, doctors use it alongside other tests. In some cases, doctors might perform an endoscopic ultrasound, EUS. This is a more advanced procedure where a thin, flexible tube with an ultrasound device at the tip is passed through your stomach into the pancreas area. It allows doctors to get a very clear image of the pancreas and surrounding organs. If necessary, the doctor can also take a tissue sample during this procedure for further testing. Another key diagnostic tool is a biopsy, where a small sample of tissue is taken from the pancreas and examined under a microscope. This is usually the final step in confirming whether or not cancer is present. It provides the most accurate diagnosis because it directly examines the cells in question. Now let's talk about treatment options. If pancreatic cancer is caught early enough, surgery may be an option. The most common surgery is called the Whipple procedure. In this operation, part of the pancreas, part of the stomach, the gallbladder, and part of the small intestine are removed. It's a major surgery, but it can be life-saving if the cancer hasn't spread. However, many people are diagnosed when surgery isn't possible because the cancer has spread to other areas. In these cases, doctors turn to chemotherapy. Chemotherapy uses powerful drugs to kill cancer cells, slow their growth, or shrink tumors. The treatment usually involves multiple cycles and can cause side effects like fatigue, nausea, and hair loss, but it's often necessary to keep the cancer under control. Radiation therapy is another option where high-energy rays are directed at the cancer cells to destroy them. Radiation can be used alone or in combination with chemotherapy, depending on the stage and location of the cancer. While it doesn't always cure the disease, it can reduce symptoms and prolong life. In recent years, newer treatments like targeted therapy and immunotherapy have emerged. These treatments are designed to attack cancer cells more precisely, often with fewer side effects. Targeted therapy blocks the growth of cancer cells by focusing on specific molecules, while immunotherapy boosts your immune system to better fight off the cancer. However, these therapies are still under study for pancreatic cancer and are usually reserved for patients who aren't responding to traditional treatments. Let's do a quick recap. We talked about the warning signs of pancreatic cancer, like jaundice, abdominal pain, weight loss, and fatigue. We also discussed the risk factors, including smoking, family history, and obesity. Then we covered the diagnostic procedures doctors use, like blood tests, endoscopic ultrasounds, and biopsies. Finally, we went over the treatment options available, such as surgery, chemotherapy, radiation therapy, and newer approaches like immunotherapy and targeted therapy. If you or someone you know is experiencing any of these symptoms, don't wait. Get checked as soon as possible. Pancreatic cancer is dangerous, but early detection can make a huge difference in the outcome. Thank you so much for watching, and remember, we're almost at our milestone of 500 subscribers. If you haven't subscribed yet, please hit that button and join our community. Let's keep learning and taking care of our health together. Stay safe, and we'll see you in the next video.